My name is Marina de la Garza. I'm going to be finishing Chapter 13, Rehabilitation, starting with speech therapy. So speech therapy is just going to be used to help retrain the muscles that are used in speech, understanding words, numbers, and gestures. The muscles that are involved in speech are also used in things such as breathing and swallowing, so speech therapy can also help with those things. Next, we're going to talk about rehabilitation for specific problems. So, heart disorders, stroke, hip surgery, knee replacement, leg amputation, speech disorders, blindness, and hearing loss. So, for heart disorders, as we know, that's typically known as cardiac rehab. This is going to help after heart attack or heart surgery, or when heart failure has progressed. The goal is for people to care for themselves and be independent. This is going to be done as soon as possible in the hospital. It's going to start with a low demanding activity like them getting in and out of a chair, and then progress to higher activities such as them getting dressed, doing their hair, stuff like that. Before being discharged, the doctors are going to measure their heart rate and breathing just to see what things they can and can't do well once they get home. So typically they want them to resume full activity after 6 weeks of being discharged. Cardiac rehab is typically 3 times a week for 8 to 12 weeks. Over that time, the number and intensity of activities is going to slowly increase to be able to resume full activities by those 6 weeks. And it's also going to help with the physiological effects. For them to learn lifestyle changes like, not smoking, eating better, changing diets, exercising, all of that. Next, we're going to talk about stroke. Therapy for this is going to be for recovering anything that was lost, so like speech from a stroke. Obviously, the extent of recovery is going to depend on how well the damaged areas of the brain healed themselves. It's going to start as soon as they tolerate movement, so it's going to start with passive range of motion, the therapist moving the limbs, and then the patient being able to move their limbs on their own actively. The sooner that they start, of course, is going to be better for recovery, prevents the chances of more weakening occurring, blood clots, and even depression. After they do passive to active ranges of motion, they're going to practice moving around in the bed, so flipping, turning, and then they're going to progress to getting out of bed into a chair. Some problems such as speech, fine coordination, gait, cognition, and sight need specific therapy in order to help the patient retrain those things or to help them adapt to permanent changes that occurred from the stroke. Next is going to be knee surgery. So next to knee surgery, or hip surgery and knee replacement are going to be pretty much the same as far as therapy goes. Knee replacement is just going to be a little bit more specific to the area. So for a hip surgery, again, this is also going to want to start as soon as possible, as soon as the same day as surgery. The initial goal is going to be to increase mobility and prevent decreased muscle tone, clots, or sores from happening. The ultimate goal is going to get people walking as good as they were before they had the surgery. So for the hip, post-surgery, they're encouraged to resume activities as soon as possible for good recovery to, sitting in a chair, range of motion exercises, stuff like that. 1 day post-op, they're encouraged to do a single leg assisted balance on the unaffected leg. And as soon as 2nd day post-op, they can do single leg balance on the affected leg. Next, they're going to do gait training once they can bear weight on both legs successfully. And then from there, they're going to do stair training. And of course, they're going to need an assisted walking device like a cane or a walker just to help prevent further injury from happening or falls from occurring. Now we're going to talk about a leg amputation. So this is sometimes due to diabetes or peripheral arterial disease from atherosclerosis. Post-surgery, the remaining leg, which is referred to as the stump, needs to fully heal prior to being fitted for a prosthesis. This is just because of swelling that can occur after the amputation. So depending on the location of the amputation, you're going to want the patient to do exercises to stretch the hip and knee just to prevent stiffness of those joints. And you're going to also want them to do strength and endurance training of the upper extremity. And same with this, they're going to start in a chair and then progress to standing or balancing with parallel bars. So people who choose to have a prosthesis have to learn how to move with it on, so walking, running, things like that. A unilateral amputation below the knee typically does not need a cane. But if it's an amputation above the knee, they are going to need a cane just because movement with the knee joint is going to require a lot more energy and control needed for that. So bilateral amputation is going to often need a wheelchair. Some problems typically occur after an amputation. You're going to have either stump pain where the amputation occurred, loss or grief from losing the limb. There's also possibility of phantom limb sensation, which is essentially where they think the limb is still there, so they try and walk on it and end up falling. And then you're going to have phantom limb pain, which is similar, except it's going to be pain in the area that they had prior to the amputation of an area that's obviously not there anymore. Next, we're going to talk about speech disorders. So we have 3 speech disorders: aphasia, dysarthria, and verbal apraxia. Aphasia is going to be difficulty using or understanding speech or written language. The goal for this is going to be finding the most effective way for them to be able to communicate. You're going to have mild and severe aphasia. Mild is going to be them identifying an object from a picture. Severe is going to be words are repeatedly spoken to them, or names of objects are repeated to them and then the object is handed to them to be able to relearn words. Next is dysarthria. This is going to be difficulty physically performing words, so they'll make sounds that approximate what they're trying to say. This typically could occur from nervous system damage like MS or stroke. Again, we have severe and mild. Mild is going to be teaching them to make sounds or repeating words or phrases to relearn how to use the facial muscles to create speech. And then for severe dysarthria, this is going to be communicating like with visuals or words or letters or an electronic communication device. Verbal apraxia is going to be the inability to initiate, coordinate, or make muscle movements to be able to talk or to make sound. Again, same thing, nervous system damage from stroke, head injury, brain injury. Therapy typically, again, involves repetition of sounds or patterns, natural melodic patterns for common phrases, and then, if needed, exaggerating those melodic patterns until their speech kind of gets a little bit better. Next is blindness. This is just going to be teaching them ways to perform normal daily activities. So this would be them learning how to use a cane, learning Braille, being able to get around their home by keeping stuff in the same area, or even getting a seeing eye dog to help them get around. Lastly, we're going to talk about hearing loss. This is just teaching the patient how to read lips, use a hearing aid, and to modulate speaking volume. Because as we know, since they can't hear, they tend to talk a little bit loudly. They will also have an audiologist that comes in and helps them choose a hearing aid, as well as other devices that are specifically designed for alerts for deaf people. They could also get a trained dog that would respond to certain sounds and give them an alert of when the doorbell is ringing or if someone's around them or if their phone rings.